Has it ever happened to you? You see blood and suddenly you feel like you're going to pass out? Everything goes blurry, your ears start ringing, and you feel like life is draining from your body? It's not that you're weak, it's not that you're being dramatic, it's your vagus nerve hijacking your entire body. In the next 16 minutes, you're going to understand why your brain wants you to faint when you see blood, and more importantly, how to stop it. I'm your host, and this is Anatomy of Fear. Today, hemetophobia, the fear of blood that affects 15% of the global population. Yes, 1 out of every 7 people experiences this. But here's the paradox that's going to blow your mind. Most phobias speed up your heart. They prepare you to run, to fight. Tachycardia, dilated pupils, adrenaline. But hemophobia, your heart slows down. Your blood pressure plummets. Your legs turn to jelly. Your brain says, "There's blood, you need to faint right now." Why? Because 200,000 years ago, if you saw blood, it meant a predator had bitten an artery. And fainting, that reduced blood loss. It increased your chances of survival. Your body doesn't know you're watching a movie. Your body doesn't know it's a routine clinical test. Your body sees blood and activates the prehistoric emergency protocol. And I want you to do something with me right now while you're still listening to this. Tense your legs, squeeze your glutes, cross your arms and legs. Hold that tension. This is called applied tension. It was developed by Dr. Lars Goran Ost in the 1980s. And here's how it works. When you tense the large muscles in your body, you push blood back toward your heart. You increase your blood pressure in seconds. Your vagus nerve receives the signal. Pressure's stable, no emergency, and it deactivates the fainting protocol. You just hacked 200,000 years of evolution in 10 seconds. If you did it, comment "done" below. This isn't theory, this is pure physiology. Your body just learned it can choose not to faint. But let's understand what's actually happening in your brain, because hemophobia isn't the same for everyone. There are 3 types of responses, and yours tells you which brain region is dominating. I'm going to put 4 options on screen. I want you to be honest. When you see blood, what happens? Option 1, dizziness. Everything starts spinning. You feel like you're floating, like you're drunk without having drunk alcohol. Option 2, nausea. Your stomach churns. You feel like you're going to vomit, cold sweat on your forehead. Option 3, complete fainting. No gradual dizziness. Your body simply says, "That's it," and shuts you down, like a switch. Option 4, intense anxiety but no fainting. Palpitations, hyperventilation, urge to run away. Pause the video if you need to. Comment your number, 1, 2, 3, or 4. This isn't an internet test. This is a functional self-diagnosis that tells you which part of your nervous system is hijacking your behavior. If you answered 1, 2, or 3, you're experiencing what's called a vasovagal response. Your vagus nerve is overactivated. Your blood pressure drops, your heart rate decreases, and blood pools in your legs. That's why you get dizzy. That's why you faint. If you answered 4, your amygdala is dominating. It's a response closer to traditional panic. Your body wants to flee, not faint. And here's what psychiatry textbooks won't tell you. Hemophobia is the only phobia that has 2 completely distinct neural circuits. It can be vasovagal, it can be amygdalar, or it can be a combination of both, and the treatment is different for each one. Let's go to the neuroanatomy, because when you understand the geography of your fear, the fear loses power. Your vagus nerve is the 10th cranial nerve. It's the longest nerve in the autonomic nervous system. It's born in the brainstem, travels down your neck, through your chest and all the way to your abdomen. It connects your brain to your heart, your lungs, and your intestines. It's the superhighway of information between your organs and your head. When you see blood, visual information travels to the visual cortex. But before you understand what you're seeing, a fast route sends signals to the insula. The insula is the interpretation center for bodily sensations. It tells you, this hurts, this is pleasurable, this is dangerous for your body. The insula activates the Nucleus Tractus Solitarius, the NTS. This is a tiny structure in your brainstem that coordinates the vasovagal response. And here's where the dark magic happens. The NTS says, there's blood, activate freeze response. The heart slows, blood vessels dilate, pressure drops, blood pools in the legs, the brain receives less oxygen, and you faint. Let's go to the neuroanatomy. Because when you understand the geography of your fear, the fear loses power. Your vagus nerve is the 10th cranial nerve. It's the longest nerve in the autonomic nervous system. It's born in the brainstem, travels down your neck, through your chest, and all the way to your abdomen. It connects your brain to your heart, your lungs, and your intestines. It's the superhighway of information between your organs and your head. When you see blood, visual information travels to the visual cortex. But before you understand what you're seeing, a fast route sends signals to the insula. The insula is the interpretation center for bodily sensations. It tells you, this hurts, this is pleasurable, this is dangerous for your body. The insula activates the Nucleus Tractus Solitarius, the NTS. This is a tiny structure in your brainstem that coordinates the vasovagal response. And here's where the dark magic happens. The NTS says, there's blood, activate freeze response. The heart slows, blood vessels dilate, pressure drops, blood pools in the legs, the brain receives less oxygen, and you faint. But here's a detail that science only discovered in 2026. A Harvard study published this March used high-resolution fMRI to observe the brains of people with hemophobia while they viewed images of blood. The finding? The anterior insula activates 2.3 seconds before blood pressure begins to drop. This is huge. It means your brain predicts the pressure drop. It's not a reaction, it's an anticipation. Your insula says, blood is coming, prepare to faint, and executes the order before your body has time to assess whether there's real danger. That's why applied tension works. You get there before the insula. You tell it, no, I'm already tense, pressure is high, don't execute. You break the predictive cycle. Let's take a mental pause. I want you to answer something. When you faint at the sight of blood, what do you think is happening? Option A, I'm weak, it's mental. If I were stronger, it wouldn't happen. Option B, my brain is protecting me from something. Option C, it's purely psychological, the result of trauma. Option D, it's physical, my body reacts automatically. Comment your letter, A, B, C, or D, because the correct answer is going to surprise you. The correct answer is B and D simultaneously. It's physical and your brain protecting you. Stanford Study 2025, Department of Evolutionary Biology. They analyzed why hemophobia persists in the population if it apparently has no adaptive advantage in the modern world. The conclusion: avoidance of internal bleeding. In prehistoric environments, seeing blood could mean that you or a member of your tribe had an internal wound. The vasovagal response forced you to stop, to not move, to not aggravate the bleeding. Fainting reduced blood flow to the extremities and preserved blood for vital organs. But there's more. UCL Study 2024, University College London. They discovered that the Nucleus Tractus Solitarius doesn't just coordinate the vasovagal response. It also receives direct information from the vagus nerve about the state of the blood, pH, oxygen levels, presence of certain hormones. Your brain knows, at an unconscious level, whether the blood you're seeing is yours or someone else's, whether it's fresh or clotted, whether it represents real danger or not. But in people with hemophobia, that fine discrimination is lost. Everything triggers the alarm. That's why seeing blood in a movie causes fainting in some people. The brain doesn't distinguish fiction from reality when it comes to survival.
And now we get to what you came here for: how to get out of this. Hemophobia is one of the most treatable phobias if approached correctly, but the wrong approach can make it worse. Traditional treatment was gradual exposure. It works, but it has a 40% dropout rate because the vasovagal response is so intense that people can't tolerate it. They faint during sessions and abandon treatment. But in 2023, a team at Karolinska Institute in Sweden published a modified protocol with a 91% success rate. And it's based on something called interoceptive exposure combined with applied tension. Here's the 21-day protocol. 3 weeks, 7 days each. If you commit to this, your relationship with blood will never be the same.
Week 1. Applied tension with fake blood. Every day, for 5 minutes, you're going to sit in a chair, apply the tension technique we just did, and look at images of fake blood. Movie blood, Halloween blood, corn syrup blood. Your brain doesn't know the difference at first, but your body learns that blood plus tension equals no fainting. You're creating a new association. Week 2, real images. Photographs of real blood from medical sources, surgical procedures, wounds, always with applied tension. If you feel dizzy, you stop, you increase the tension, and you continue. Your insula begins to recalibrate. It learns that these images don't require the fainting protocol. Week 3, controlled real exposure. This could be watching a blood draw at a clinic, or holding a blood bag, or, if you're ready, a controlled blood test with medical supervision, always with applied tension. This isn't easy, but hemophobia doesn't respond to talking, it responds to doing. If you're committing to this, comment day 1 below. Not for me, for you, so that in 21 days you can come back and tell us it worked. Let me tell you about Marcus, 34 years old, firefighter. Imagine that, a firefighter who faints at the sight of blood. For 10 years he hid it. He would volunteer for every task except medical emergencies. Until one day, a fellow firefighter was injured on the scene. Marcus had to act, and he froze. His body went into vasovagal response right there in the middle of an emergency. He didn't faint completely, but he was useless for 3 minutes. 3 minutes that could have cost a life. Marcus found the Karolinska protocol, did it for 21 days. Today, he's the first responder for medical calls in his station. He still feels the initial signal, but applied tension has become automatic. He does it without thinking. His insula learned. Or Sarah, 22 years old, medical student. She chose medicine knowing she had hemophobia. She thought she could overcome it by willpower. During her first blood draw practice, she fainted, hit her head on the way down. Concussion. She almost left medical school. The Karolinska protocol gave her a second chance. Today, she draws blood from patients without issues. She tells them, if you feel dizzy, tense your legs. It works. Your brain has what neuroscientists call neuroplasticity. It can change. The pathways that connect your insula to your Nucleus Tractus Solitarius can be weakened. New pathways can be built. But here's what no one tells you. The vasovagal response is not a disorder in itself. It's a protective mechanism that's misfiring. You don't need to eliminate it. You need to recalibrate it. You need to teach your brain when it's appropriate and when it's not. That's why this protocol works. You're not fighting your biology, you're training it. Before we close, I need you to do something. There are 3 people who need to see this video. Person number 1, someone who avoids medical tests because they're afraid of fainting. Person number 2, someone who faints at movies at the sight of blood on screen and feels embarrassed about it. Person number 3, someone who thinks this only happens to them, that they're alone in this, that they're broken. Tag them in the comments right now. Send this to someone who needs to know they're not broken. Next video, why your prefrontal cortex freezes when all eyes are on you. Hemophobia is not weakness. It's your 200,000-year-old survival system doing its job a little too well. Now you know the anatomy. Now you have the tools. This has been Anatomy of Fear, and I'll see you in the next episode.